Hello everyone, this is MBBS Gallery and today we are going to see about an important drug called metformins that comes under the group of biguanides. This metformin is actually one of the most important drug, that is first line drug, which was suggested by each and every doctor for the antidiabetic patients. So this metformin need to be a important place in the diabetic drugs. So we have another biguanides are also, that is metformins, fenformins and buformins, but these fenformins and buformins tend to produce lactic acidosis. Due to that, these two drugs are withdrawn from the markets, but these metformins are in use and this is the best drug. So what is the mechanism of action of metformins actually? This metformin is going to be metabolized, that's going to be act on the liver by suppressing the gluconeogenesis, nothing but and glucose production by the non-carbohydrate sources, and it also inhibits the glucose outputs by acting on the livers, and it acts on the intestine by inhibiting the absorption of glucose from the diet. So it also acts on the skeletal muscles and adipose tissues and makes these cells to sensitizations towards the insulin and stimulates the glucose utilizations and thus lowers the blood glucose levels. It has none of the reaction. It has none of the role towards the beta cells of the pancreas, so that the most important adverse effect, that is hypoglycemic, one of the most important, all the anti-diabetic drugs having the hypoglycemic adverse effects, which was here absent because these drugs have no role towards the pancreatic beta cells. So let us see about in clearly. Little things about the biguanides metformins are, there is no action on pancreas, we already know that, so that there is no release of insulin, so there is no risk of hypoglycemia, first point. And it is also called AMP activated protein kinase, in short AMP kinase. So AMP kinase is it is also biguanides metformins called AMP activated protein kinase, and it is the first line drug towards the type 2 diabetes mellitus all over the world, and it reduces both micro and macrovascular events. What are the microvascular events? Microvascular events includes angiopathy and retinopathies, and macrovascular events includes cardiac, cerebrovascular and cardiac diseases. So these are gets reduced by using of metformins, and there is a mild weight reduction by this drugs, or it tend to be called as a neutral weight. Neutral weight will be maintained the weight as it is. This is IGT. IGT is nothing but impaired glucose tolerance. So impaired glucose tolerance, which means here we are stressing here that this drug actually delays the progression towards the diabetes, which is most important, a good thing about this drug. So weight neutral, progression towards the diabetes is delayed, and it reduces both micro and macrovascular events. And now we are going to see about the uses of metformins in PCODs. Actually, this PCOD is accompanied by the symptoms of hirsutism and ovulation impairment. So this drug actually helps in the improvement of the ovulation and also reduces the symptoms of hirsutism. And what about the kinetics? This drug is actually excreted in unchanged forms. So this is unsafe in renal failures because the excretion is the kidney. So we have to use with caution here, and this is most important thing here. This metformin is actually a radio contrast. So in order to take a CT, in order to get radio investigations, we have to stop the metformin one day before, because these CT investigations, radio investigations along with metformin, both of them are radio contrast, may result in nephrotoxicity. So in order to prevent that, we have to stop this metformin one day before the radio investigations. And ADA. Most commonly, these areas include GI toxicity generally, that is nausea, indigestions, diarrhea, B12, vitamin B12 deficiencies. But rarely it also causes lactic acidosis as that of the fenformins and buformins. So rarely, this is actually rarely, but it can also cause lactic acidosis in whom this is kidney, liver, cardiorespiratory insufficiencies and alcoholism patients can lead to lactic acidosis. This is all about the biguanides, the metformins. I hope this will help you to learn an important points about the metformins. Okay, later you guys should support us to more videos and help us to improve our knowledge towards you. Thank you and support us.